we serve as the administrators for the first statewide coordinated care network, leveraging the United's technology, connecting individuals to community-based organizations in the state of North Carolina. So we really look at connection rates, how many of our customers are actually being connected to services. And then we also look at that as far as capacity goes. So that tells us what our capacity constraints are in certain situations, because what we know is that capacity is an issue. The technology provides a solution to connect to resources, but those community-based organizations still have staffing, capacity needs, and things like that. We also look to measure how many organizations are actually on the platform and using it as a measure of success, because what we know is that communities who have more organizations on the platform, they benefit greater in those situations. The state of North Carolina took up this initiative with the leading agency being the North Carolina Department of Health and Human Services. It is a cross-collaborative team effort. And so for us, what it looks like in the state of North Carolina is that the North Carolina Department of Health and Human Services serves as our strategy partner, helps to identify funding. The Foundation for Health Leadership and Innovation serves as administrators. So we hold contracts with all of our vendors and implementation partners. United is a technology vendor. We also contract with the United Way of North Carolina to leverage their 211 system. And then we also have employed some navigators within the United Way of North Carolina. And then we also partner with NC Serves, who is our Veteran Serving Coordination Center. So it is a cross-collaborative effort to make it happen in the state of North Carolina. What we know is that this works best when communities adopt it. As organizations who work statewide, we don't know uniquely the issues, problems, concerns within communities as well as the communities do. And so for them to tell us what their needs are, how they choose to leverage the platform, how they want to communicate from community-based organization to community-based organization, really is how this platform works best. The community members like to see individuals that they have trust with in their communities, organizations that they already are dealing with in their communities. And so that kind of down-up approach to this work has been really helpful for us in proving successful. North Carolina started with this great idea of implementing NC Care 360 and using a United's technology right before COVID started. And then we had a fantastic plan about how to appropriately and timely scale. Unfortunately, because of the pandemic, we had a rapid growth of the network. So one of the things I would say is be strategic in the way that this is rolled out and move at the speed of trust. And so, like I said, working with your community stakeholders to do that. So in North Carolina, we have the United's technology for anybody across the state who has an SDOH need. And then on top of that, we have our Healthy Opportunities pilot, specifically using the payments model for Medicaid beneficiaries. And so we have kind of a dual role in our state, but I would say the biggest thing is collaboration and a rollout that is strategic and thoughtful, timely, and includes your community stakeholders. One of the things that when we talk to community-based organizations about joining our platform, it really is an opportunity to streamline your processes and to move things electronically. We know the work is already happening. The referrals are already coming and going, either coming in your front door or out your back door if you're a sending organization. And so community-based organizations really have the opportunity to leverage this technology to streamline their processes and really to gather data. So a lot of the organizations that we work with really closely tell us how beneficial the data is for grant funding and even just understanding their workforce, their client base, so that when they are, trying to understand, do we need to expand our services and what areas we need to expand our services, they actually have the data to make those data-driven decisions.